My name is Ashlyn Blankenship, and my mentor is Miss Donna Caldwell. For this year's Create at State, I researched a Micra Transcatheter pacing system. In the United States, more than 2 million people are affected by irregular heart rhythms or arrhythmias, and the most common treatment option for these patients is a pacemaker. Traditional pacemakers work by controlling the electrical activity in the heart, and that corrects arrhythmias. For traditional pacemakers, an incision is made and a pocket is made under the skin on the chest. The pacemaker is then implanted in that pocket and then sutured in. Leads are attached to the pacemaker and they travel through the left subclavian vein into the heart. Well, in 2016, Medtronic, a medical device company, released a new pacing system called the Micra Transcatheter Pacing System, or the Micra TPS. This new device is similar to traditional pacemakers in that it does correct arrhythmias. However, that pacemaker is implanted via a catheter through the vein in the patient's thigh, so there's no incision made in the chest and no pocket made under the skin. For this reason, the Micra TPS provides a better treatment option to patients in need of single chamber ventricular pacing. I examined infection, complication, and success rates for the traditional pacemaker and the Micra TPS, as well as assessed the risk and benefits of both pacemakers. To examine both pacemakers, I evaluated clinical trials and gathered information from Medtronic. Patients who are candidates for the Micra pacemaker include patients with atrial fibrillations, or AFib, and symptomatic bradycardia and tachycardia. The Micra, however, is not safe for patients with inferior vena cava filters, mechanical tricuspid valves, previously implanted traditional pacemakers, or patients with morbid obesity. The Micra is 90% smaller than a traditional pacemaker, and it requires no leads, no incision on the chest, and no pocket under the skin. For this reason, the complication rate is only 2.7%, whereas the complication rate for a traditional pacemaker is 9.4%. The Micra has more than a 99% success rate with less than a 1% infection rate. With a traditional pacemaker, there is a surgical scar from the incision that's made on the chest, and the device leaves a visible lump under the skin. Most traditional pacemakers are not magnetic resonance imaging safe, or MRI safe, whereas the Micra is MRI safe up to 3 Tesla, which is the strength of the majority of MRI machines in most hospitals. The Micra has a minimum battery life of 10 years, and when the battery does expire, a new Micra is simply placed next to the previous one. There's no need for surgical removal of the device. A traditional pacemaker has a battery life of anywhere from 5 to 15 years, but when the battery of a traditional pacemaker expires, it requires surgical removal. This is a chest x-ray showing a traditional pacemaker, which is right here, and it shows the leads coming from the pacemaker through the left subclavian vein down into the heart. So here's where the incision is made, and there will be a lump under the skin right there. This is an x-ray showing a Micra pacemaker. As you can see, it is much smaller than a traditional pacemaker, and there are no leads anywhere. On the left here is a traditional pacemaker, and on the right here is the Micra pacemaker. As you can see, again, it's much smaller, and it's roughly the size of a quarter. Every year, approximately 1 million pacemakers are implanted in the United States. Therefore, it's important to know the different options that are available to patients. And the more informed we are as healthcare professionals, the better we can advocate for better and safer treatment options for our patients.